Hello. In this lecture, we'll be talking about medication calculations. This lecture will be divided into two main parts. The first part will be talking about drug computations, and then the second part will be talking about intravenous computations. So, this discussion is primarily grounded on your Unit 2 Study Guide 1. I will be using the same Microsoft Word file that I have distributed through your respective Canvas account to guide this discussion. This study guide has been shared to you to guide you on the calculation exercises that we will be having. So please take note that I have used actual medications here, medications that are commonly used in the Philippine healthcare setting, specifically in our locality. Okay, this is for you to understand how these medications work in an actual clinical setting. And this will also help you picture out the reality of computing your medications. So the first page of your handout would detail the formula. Okay, the formula for the computation of your medication, the amount of medication that will be administered to your patient. So that's desired dose over stock dose or on-hand dose times vehicle. When I say desired dose, that answers the question, how much do you want to give to your patient? Or in other words, what's the doctor's order? How many milligrams does the doctor want to be given to the patient? The denominator, stock dose or on-hand dose, refers to the amount of drug available at our disposal, or available at our pharmacy, available at our nurse's station, or the one that is being sold in the market. Times vehicle. When I say vehicle, this means the amount of substance that contains the milligrams that you intend to have. Okay, for example, when I say that there is paracetamol, 250 milligram per 5 ml, the vehicle there is 5 ml. That simply means that 250 milligrams of paracetamol could be found in 5 ml of paracetamol. In other references, they would refer to vehicle as volume. Okay? Another example would be if I'm buying, for example, cefuroxime, 500 milligram tablet. Okay? The tablet there is the vehicle because it is the one that contains the 500 milligrams of your cefuroxime. Now, let us not confuse amount of substance, which is in milligrams, to the volume of the substance, which is commonly expressed in ml. Take note that the amount that we are giving to our patients is the volume of the medication. Okay? So, oftentimes, we summarize this formula by saying D over H times V. Okay, you will see in other references which would only say D over H times V. Again, I would like to redo that as D over H times V. And that will be the amount of drug that will be given to the patient. Then, we also use the weight of the patient to determine the client's dose needed per day. For example, when I say drug dose, okay, a typical example of that is saying 80 milligrams per kilogram per day. And then if my patient weighs, for example, 50 kilograms, I would multiply it to determine the client's dose per day. Tip, do not overwhelm yourselves by thinking about milligram/kilogram/per day. Okay, just think of it in English. It's 80 milligrams in every kilogram in every day. So meaning your patient will be receiving 4,000 milligrams per day. Okay, which means if the doctor will say that this should be in 2 divided doses, you know that your patient will be receiving 4,000 milligram per day divided by 2 doses per day. Okay, let's say divided by 2 doses per day. That would give you 2,000 milligrams per dose. That's how it works. So that's the 2 major formula. Then, you have your Freyd's rule, your Rank's rule, and your Clark's rule. These 3 rules are being used for the computation of pediatric doses. Okay? Computation of pediatric doses. In our healthcare setting in the Philippines, this is usually done by the doctors. It is the physician who computes for the required milligrams that will be given to the pediatric patient. Okay, but it's wise for us to know this because if you'll be preparing for NCLEX and other examinations, you need to be familiar with this. Freud's rule. This is used to compute for the dose of the child less than 1 year. So, it's the infant's age in months, take note, over 150 months times the average adult dose. Young's rule. It's the child's dose for children ages 1 to 12 years old. And then the formula would be child's age in years divided by child's age in years plus 12 times the average adult dose. On the other hand, your Clark's rule would make use of the weight of the child. So the child's dose is equal to weight of child in pounds divided by 150 pounds times average adult dose. If you can recall, a kilogram is equal to 2.2 pounds in such a way that 10 kilograms will be 22 pounds. Okay, it should come handy to you. Then, you have your body surface area calculation. Okay? The dose of the child could also be computed using the body surface area. But first, you need to determine the body surface area. The body surface area in meters squared is equal to the square root of the values of the height, which should be in inches, times the weight in pounds divided by 3,131. Or it could be height in centimeters times weight in kilograms all over 3,600, and the square root of which. Now that you have determined the body surface area of the child, to compute for the child's dose, it will be BSA of child's in meters squared all over 1.73 meters squared. What is 1.73 meters squared? That is the body surface area of an average adult. Then times average adult dose. And that would help us determine, or that would help the healthcare practitioners determine the child's dose suitable for the child. Then we have your intravenous solutions. For your intravenous solutions, to get or to determine ml per minute, that would simply be ml per hour divided by 60 minutes. Okay, we give you ml per minute. Okay, a typical example would be, for example, the doctor would say plain NSS 1 liter times 60 ml per hour. For you to determine the ml per minute, okay, if I would copy the formula and then transcribe our details there, so you know it's 60 ml per hour as per the doctor's order, divided by 60 minutes. And then that would give you 1 ml per minute. That would give you 1 ml per minute. Then the next formula is ml per hour. If, for example, the doctor would order, for example, plain NSS 1 liter times 8 hours. For us to determine the ml per hour, we would need the volume in ml. So our volume here is 1 liter. 1 liter in ml is 1,000 ml divided by 8 hours. And that would give you 1,000 divided by 8. You can use your calculators, yes. That will be 125 ml per hour. Duration in hours. For example, if the doctor would order plain NSS 1 liter times 100 ml per hour, the duration in hours will be equal to volume in ml divided by ml per hour. So the volume in ml will be 1,000. That's the total volume of your IV fluid. And then the ml per hour is 100 ml per hour. 1,000 divided by 100, that would give you 10 hours. That means that this IV order should last for 10 hours. In computing your answers, especially if you're doing it in a piece of paper, it would be wise for you to box your final answer. Now, let's talk about the drops per minute. You might be wondering, if this is your first time to calculate for the drops per minute, you might be wondering, how do nurses determine the number of drops of that dextrose, quote unquote, that can be found in the clinical setting? Okay, first, we do not refer to those as dextrose. They should be referred to as intravenous fluids. not all intravenous fluids contain dextrose. Okay? An example of which is plain NSS. Your PNSS, or your plain normal saline solution, does not actually contain dextrose. Whereas your D5 NSS, okay, or dextrose 5 normal saline solution would contain dextrose. On the side, so let's continue. For example, if the doctor would say plain NSS, 1 liter times 8 hours. For you to determine the drops per minute, I'll be copying this formula so that I can reflect it clearly here. Allow me. Okay, should be here. There. Now, the volume in ml is 1,000. Okay, it says there in the given, 1 liter. Drop factor. There are several drop factors. Okay, it could be 15, it could be 20, it could be 60. You need to know that 15 and 20 are known to be macroset. And then your 60 is known to be a microset. What does drop factor stands for? Okay, what does drop factor stand for? When I say drop factor, it is the number of drops that takes to form 1 ml. Again, a drop factor is the number of drop it takes to form 1 ml. In that case, if you're using microset, okay, usually your microset could be easily differentiated because of the presence of a needle-like tube, okay, or needle inside the chamber of the IV fluid. Okay? So when I say microset, it takes 60 drops for it to form an ml. And then your macroset, your 15 and 20, okay, would take 15 or 20 drops before it would form an ml. In this case, I'll take this one as a macroset. Usually, this is given and predetermined, but as a matter of tip to you, okay, if the rate of the IV fluid is less than 60 ml or less, microset is usually used. If we're talking about IV rates, which is more than 100 ml, we usually use your macroset. There are other guidelines. For example, we take into consideration the condition of the patient. If your patient has hemorrhage, excessively bleeding, you'd be needing a macroset because your macroset will be able to administer the fluids quickly. If your patient, for example, has chronic kidney disease, chronic kidney disease may still sound foreign, but when I say chronic kidney disease, okay, let's think of it as kidney impairment, meaning there's a problem with the kidney. Okay, the kidney could not excrete water. Remember, lessons in anatomy would tell us that it is the kidney, okay, that forms our urine. So let's think of chronic kidney disease as cannot excrete water in urine. If this is the case of your patient, okay, you need to place your patient on a microset because your microset will prevent the sudden administration of your IV fluids. You would want the IV fluids to be administered accurately in such a way that it will not be able to disrupt, okay, the normal physiology of your patient. The same case if your patient would have congestive heart failure. Okay, when I talk about congestive heart failure is the inability of your heart to carry heavy workload. Let's think of it that way. Meaning, if you will be giving a lot of fluids to this patient, your patient would not be able to tolerate. Okay? We need to regulate the fluid accurately. Hence, I will be using microset. Now, I think you're familiar of dengue. Okay. Dengue leads to hemorrhage. So what do you think will be the set that will be used? That would be your macroset. Okay, we'll be using your macroset. Now, it says here 15 and 20. How will I know if it's 15 and 20? Okay, that would depend on the brand you use. Okay, so you better watch out for that drop symbol that can be found on the packaging of your IV fluids. Okay, allow me to show to you some illustrations. This is where you will be seeing the drop factor. So this one is a packaging of your intravenous set. Okay, so this one is that of a company, Braun. Now, if you would look at and focus closely, you would see that there is a drop factor here. So this is the drop factor. okay, it takes 20 drops to form an ml. Okay, so meaning the drop factor of this IV set is 20. Okay, that's how you would check on that. If you notice, there's also manufacturing date and there's also expiration date. Okay, crucial things that you need to check before you get the supplies from the supply room in the hospital. Now, so that we are not imagining things, here is your macro set. This is a macro set. Be careful with the spike, it's considered to be a sharp object. Okay, so this is a macro set. Observe this part here. Now, this is a micro set. If I would focus your micro set, you would notice that there's a needle-like structure inside. Okay, that minimizes the drops. So that's your micro set. This one is a volumetric chamber. Okay, oftentimes referred to in the clinical setting as oftentimes referred to as your soluset. Okay, soluset. So when they say soluset, as you can notice, this is still a microset. The volumetric chamber is usually used if we would want to strictly regulate the fluids being administered to the patient. Other than that, it is also used for antibiotic administration. And if we want to have additives, okay, or medications are added to a certain solution, it is done in a volumetric chamber. For example, if you will be giving a certain medication, we refer to it as your norepinephrine drip, for example. I will be mixing plain NSS and norepinephrine inside the volumetric chamber. Okay? Take note that the setting abroad may vary. Okay? Abroad, instead of using this formula to compute for the IV fluids or the rate of IV fluids, they are already using your infusion pumps. We have infusion pumps in the Philippine setting. However, the use of infusion pumps here are limited compared to that abroad, where all the rooms abroad may have the infusion pumps. Here in the Philippine setting, we reserve that one for our high acuity patients. Or in other words, your patients who are in the intensive care unit or needing intensive care for that matter. Furthermore, okay, there are different sets which are being utilized abroad. Okay, so familiarize yourselves with the principle and do not just memorize because it may vary between healthcare institutions. Now, let's give it a try. I will go back to my example, which is plain NSS, 1 liter times 8 hours. I'll be using a macro set. Let's say I'll be using that set that I showed you earlier. That would give us a drop factor of 20. Okay, so macro set with a drop factor of 20. Say, so 1000 ml, this is the amount, times the drop factor, which is 20. Then the number of hours, it says 8 hours, times 60. That will give me the drops per minute. 1000 times 20 is, it's playing between 20,000. And then 8 times 60 is 480. So let's say 20,000 divided by 480. Ticking on my calculator. Okay, that would give you 41.67 drops. 41.67 drops. Do we have a 0.67 drop? Of course we don't. Okay, so we say 41 to 42 drops per minute. Okay, we can't count 0.67 here. Okay, that's just an overview on how we go about with it. Okay, don't be overwhelmed yet. I'll give you specific examples as we go along. Let us talk about the formula for getting the amount of drug that will be administered to our patients. So I'll go back to the formula that I've introduced earlier, which is your D over H times V. Okay, the basic that every nurse should know. D over H times V. In ratio and proportion, so that H is to V is equal to D is to X. X here is the amount of drug to be administered. For the purpose of this discussion, I will be using the formula D over H times V. Okay? I hope that you will be with me and you follow through as I go along. Let's have the first example. The doctor ordered aspirin 650 milligrams every 4 hours. Side learning, aspirin, it's a blood thinner. It's a blood thinner. Nursing intervention, risk for bleeding. Now, what's the desired dose? Desired is the doctor's order. It says here 650 milligrams every 4 hours. Let's see if we can use that detail later on. Stock, aspirin 325 milligrams. So that's what's on hand, 325 milligrams. Then the volume, 1 tablet. Let's do the math. 650 divided by 325 times 1 tablet. That would give you 2 tablets. The benefit, if you are copying, including the units, is that you'll be able to show later on how to cancel. For example, in this one, milligrams and milligrams are canceled out, meaning you are sure the tablet is the one that is left. I hope you got it right. Now, let's have the second example. I'll still be copying the formula. Now, it says paracetamol, 500 milligrams, suspension. Now, the stock is paracetamol, 250 milligrams per 5 ml. I hope that you know what paracetamol is for. Paracetamol, okay, to add up on our knowledge, antipyretic. Let's use the term antipyretic rather than saying it's just for fever. Going back, what's the desired? 500 milligrams. Yes, that's what we want to give. What's the stock, or what's on hand? 250 milligrams. What's the volume? 5 ml. Get your teeny little calculators. Then 500 divided by 250, that would be 2 times 5. Will be giving 10 ml to your patients. Okay? You need to be careful. Okay? You need to be careful. Why? There are several preparations of paracetamol. There is a paracetamol which is 100 milligram per ml. There may be a paracetamol which is 125 milligram per 5 ml. Okay? The volume is usually dependent on the age in which it will be administered. So be careful. That's why you need to read the doctor's order and compare it with the stock. Okay? You may pause the video now and try to answer question number 3 on your own before you proceed. Question number 3, lithium carbonate, 300 milligram PO, BID. BID, that gives you an idea, 2 rhymes a day. What's lithium for? Okay. Lithium, very good drug. Okay. It's usually for psych disorders. We use this one for bipolar disorder. And there are other indications, of course. Stock, we have lithium carbonate, 150 milligram per tablet. How many tablets will I give at once? Common sense will tell you. 300 milligrams, I have 150 milligrams. Oh, I need 2 tablets. Okay, good common sense on that. But still, let's go back to the formula. Okay, let's always go back to the formula, because when we encounter complicated things, the formula will make it simpler for you. I'm copy and paste my formula from the previous item here. Now, what's the desired? Desired is 150 milligrams. Oh, no, the desired is 300 milligrams. What's on hand? 150 milligrams. What's the vehicle? There's no 5 ml or 1 ml or 3 ml here. It's the tablet. So 300 divided by 150, that would give you 2 tablets. So I will be giving 2 tablets at once. It says, how many tablets needs to be purchased for 24 hours? So you know that this is taken twice a day. So you have 2 tablets per dose, and then a day we need 2 doses. And that would give you 4 tablets. I hope you got it right. Now, on the 4th example, this is an IV, an intravenous medication. Let's talk about ranitidine, 30 milligrams IVTT every 8 hours. Ranitidine, this is, we commonly refer to this one as antacid. Okay, later on you will know what's the difference between antacid and other medications. On the pharmacologic sense, this is referred to as H2 receptor antagonist. Okay, H2 receptor antagonist. When I say H2 receptor antagonist, they act by decreasing the acid production. Okay, they act by decreasing the acid production. Improvement on spelling. Now, when I say H2, your histamine 2 in fact triggers your acid production. So when I say H2 receptor antagonist, they stop the acid production. Going back to our computation. Okay, let's have the formula. Let's copy, let's drop some formula here. Okay, let's put it here. I'll be placing it here. There. What's the desired? 30 milligrams. What's the stock on hand? 50 milligrams. What's the vehicle or volume? 2 ml. So let's do the little math. Pick up your calculators and then say 30 divided by 50 times 2 ml. That would give you 1.2 ml. Meaning, I will be using 1.2 ml of ranitidine for my patient every 8 hours. Okay. It's an ampule, so 1.2 ml. Let's go back. Paracetamol. You may pause the video if you would want to practice on your own. Paracetamol, 8 ml, 250 milligrams IVPP. PRN is needed every 4 hours. Stock is paracetamol, 300 milligram per 2 ml. You know what paracetamol is. It's an antipyretic. To add more to that knowledge, other than being an antipyretic, your paracetamol is also an analgesic. Your paracetamol could also be used to relieve pain. Okay. This one is an IV preparation of your paracetamol. Let's try. Desired, it's 250 milligrams. On hand, yes, 300 milligrams. Vehicle, that would be 2 ml. And let's do the math using our little tiny calculators again. Okay, so you have your 250 divided by 300 times 2. That would give you a value of 1.66. Okay, and a continuous decimal for that matter. Okay, it's continuous, 1.666. Now think, to what number should I round this off? Okay, that would be to round it off to the nearest tenths, and that would be 1.7 ml. Why the nearest tenths for that matter? Okay, because if I'm using the syringe, usually the syringe could only read up to the tenths level. If I'm using the medicine cup, it can only manage up to the tenths level. So 1.7. Okay, we use the basic principle in rounding off. Okay, if the digit after which is 5 and above, okay, it's rounded out. If it's 4 and below, it stays as is. Okay? I hope that this clarifies some of the computation. Now, let's move a little bit further. Okay? Now we'll be applying your other formulas for the computation. Now, we will be using the body weight calculation. So, in this case, the order is cefixime. Cefixime is a brand, 8 milligram per kilogram per day in 2 divided doses. The child's weight is 30 kilograms. What is the total milligram in 24 hours? Going back to the formula, which can be found here, which is also on the first page of your handout. So you have drug dose. The drug dose is 8 milligram per kilogram per day. Do we really have to copy that? Yes. Times 30 kilograms. 8 times 30 would give you 240. Now, kilogram is already canceled out. There's a kilogram here, a kilogram here. So 240 milligram per day. Okay, so your patient will be receiving 240 milligram per day. Backs that answer. Okay? Now, the question is, how many milligrams per dose? Since we have 2 divided doses, what are we going to do? Yes, 240 milligram per day. Okay, divided by, allow me to pick the symbol for divided by, there, 2 doses. That would give us 120 milligram per dose. Mhm. The problem continues. How will you administer it? How many ml will I administer in a single dose? Reading at the question, I think I'll be needing my formula here. Sorry, I'll still copy this formula to here. Okay, let's copy it there. Okay, let's just replicate it in case it will be needed later on. Now it says the stock is cefixime 100 milligram per 5 ml. What was our desired? If you would look at it, the order was 8 milligram per kilogram per day. But experience on the above computation would tell us that that is not the numerator that we're using. So we've computed it. These questions has guided us to compute it. So our desired is 120 milligrams. In that case, 120 milligrams divided by 100 milligrams times 5 ml. You got it right if you said 5 ml. If not, go back to the video and review. Calculators up, 120 divided by 100 times 5. It says here, it should give 6 ml to my client. 6 ml of cefixime. What is cefixime, by the way? Cefixime is an antibacterial. Okay, specifically, it is considered to be a cephalosporin. There are a lot of antibiotics. We'll know that later on. Those that starts with ceph are of the cephalosporin family. Okay, so you have cefixime, you also have cephalexin, you also have cefuroxime, you also have ceftriaxone. Interesting family of cephs. Now, let's have more applications. It says here, azithromycin, Citromax, 10 milligram per kilogram suspension, ODPO. That means once a day per oral. Child's weight is 12 kilograms. How many milligrams shall be administered? We know that we need 10 milligram per kilogram. I would multiply that with 12 kilograms. That would give me 120 milligrams. Stocks available are enumerated below. Which one will you use? Let's see the order. Azithromycin, Citromax, 10 milligram per kilogram suspension, ODPO. Which one will I use? A, Citromax, FC tablet, 250 milligrams. This is a tablet, so it's a no-no. We need a suspension. FC tablet, 500 milligrams. We're not into tablets. Powder for injection. Do I need a powder for injection? This is a suspension, not for IDTT. The answer would be Citromax powder for oral suspension, 200 milligram per 5 ml. How many ml will you administer to your patient? That would go back to our formula. Our formula, D over H times V. What's the desired? 120 milligrams. What's the on hand? 200 milligrams. What's the volume? 5 ml. And if I do the math, 120 divided by 200 times 5 ml would give us, well, 3 ml. So I'll be administering 3 ml of azithromycin, Citromax. Azithromycin is a macrolide. It's an antibiotic. Specific classification is macrolides. Okay, it's already higher generation of antibiotics. Tends to be broad spectrum, meaning it can cover a lot of pathogens. Let's go to cefaclor. Cefaclor. What do you think is the classification of cefaclor? It's a cephalosporin. Yes, they belong to the ceph family. Cephalosporin. Now, how many ml? Let's read. Cefaclor, 20 milligram per kilogram per day in 3 divided doses. The weight is 31 pounds. Available, Cefaclor, 125 milligram per 5 ml. How many ml will you administer per dose? That's a direct question. What do we need to do first? We need to determine how many milligrams will I be giving to my patient. It says 20 milligram per kilogram per day, that my patient is 30 pounds. But the dose of the drug is expressed in 20 milligram per kilogram per day. It needs to be in kilograms, so I need to convert first pounds to kilograms. How would I do that? I would divide the weight in pounds to 2.2, because you know that 1 kilogram is 2.2 pounds. So picking up our calculator, let's pick it up and say 31 divided by 2.2. It says 14.09. I will copy it as 14.09 kilograms. Not wise to round off during the process. So I got 20 milligram per kilogram per day. Let's copy that. And then we know that the patient is 14.09 kilograms. Do the math. 14.09 kilograms times your 20. That will give you 281.8 milligram per day. Now, it says here, divided 3 doses. So meaning, in a single dose, that will be 281 divided by 3. Let's pick it up. 3 doses. That would mean 281.8 divided by 3, 93.93. 93.93 milligrams. Can I apply D over H times V now? Yes, my desired is 93.93. So I have 93.93 milligrams, and on stock is 125 milligrams times the volume, which is 5 ml. So 93.93 divided by 125 times 5. That will give us a value of 3.75 ml. Do we end there? No, because I cannot measure 0.75. So let's make it 3.8 ml. I hope you're learning. I hope you're getting this as we go along. Let's apply your Freud's rule. Here comes this patient, 15-month-old. Okay, this is a 15-month-old child. Can I apply Freud's rule if this will be a 15-month-old child? No. Let's correct this example for the purpose of learning. Let's have 10-month-old child, because your Freud's rule is supposed to be applicable among patients less than 1 year of age. So let's apply. Okay, 1 year of age. So what is the appropriate dose for this child? Then, child's dose in less than a year, infant's age in months is 10 months. I did that correction, 10 months, divided by 150 times 325 milligrams. And that would give us a value of 10 divided by 150 times 325. Calculator's right, 21.66 milligrams. So if it's 21.66 milligrams, that would be okay. We can take that as an answer because it's still the milligrams. We're not after the ml. The stock is 325 milligram per 5 ml. So based on this order, what is the desired? We did a computation, 21.66 milligrams. The stock is 325 milligrams. The vehicle is 5 ml. So let's do the math. Let's have 21.66 divided by 325 times 5 ml. It says here, so 21.66 divided by 325 times 5 ml. It gives us a value of 0.33 ml. Basically, you'll only be giving 0.3 ml to your patient. How is that possible? This is an elixir. So an elixir is usually a more concentrated compound. Okay, so 0.3 ml for that matter. Let's apply your Young's rule. So this is applicable for a child who is age 1 to 12 years old. Let's apply Young's rule. The age of the child is 10. And the child's age in years is 10 plus 12 times the average adult dose, which is 30. Doing the math, that would become 10 divided by 22. That then you will multiply it with 30. So you have 13.63 or 64, giving you 13.6 ml for administration. That's the application of your Young's rule. Let's apply your Clark's rule. Okay, for the Clark's rule, this is applicable if it's the weight of the child, which is given in pounds. The weight of the child is 40 pounds. Then the average adult dose is 500,000 units. Doing the math, that would be 40 divided by 150 times 500,000 units. That would give us a value of 133,333 units. Sounds easy, but you need to memorize the formula for Fry, Young's, and Clark's and know in what cases are they applicable. Try to ask yourselves now, what do you call the formula that is used for children ages 1 to 12? Better got it right. That will be your Young's rule. Now, let's go to your body surface area calculation. For the body surface area calculation, you need to determine the body surface area first. Okay, so let's try to do that. Notice the correction that I have made on the formula. So for the child's dose, okay, I'd remove the square root sign, okay, because that should not be. Okay, there was an error on my part there. Sorry for that. So this is the corrected formula for this one. Now, let's try to solve. Trying to solve for this one, okay, we know that the height is 32 inches, and then the weight is 40 pounds. And then 3131, there is a constant. So let's try to figure it out. Allow me to pull out your calculator. So 32 times 40 divided by 3131. That value, square root of which is 0.639. Okay, let's copy some significant values there. That will be the answer. And that is our BSA in meter squared. Now, with that value, we'll be able to use the formula below. So let's have 0.639 meters squared divided by 1.73 meters squared times the average adult dose, which is placed at 75 milligrams. Okay, with that, pull up calculator, and then you just divide it by 1.73 and then times your 75. There you get 27.71. Okay, in that case, that will be 27.71 milligrams. It asks for dose, so milligrams is the answer. Okay, 27.71 milligrams, since we're referring to the dose. I hope that this discussion has helped you and somehow has prepared you to answer the questions indicated here. Okay, so try to answer the exercises indicated here. If you have any questions as to how to approach these exercises, kindly refer to your respective instructors for clarification. Okay, so you have several items there. Try to study, try to answer them individually so that you will know if you were able to understand the topic that we are discussing. Okay, and then I'll be discussing intravenous solution, formula, and applications on a separate video. Thank you very much for your kind attention.